Hi, my name is Tori Johnson, and this is going to be my demonstration of an intramuscular injection. So, before performing this skill, I'm going to make sure that I follow all GPSP guidelines, do my 3 checks on the medication, and do any proper assessments that I would need on my patient before performing this. So I have already done my assessment, and we've decided that the best place for this injection is my patient's deltoid muscle. So I'm going to get started with doing my hand hygiene and put on my gloves. Okay, so then I'm going to assess my patient's injection site. Everything looks good. They have no irritation. I've already educated them on the shot today. They know that they are getting a flu shot as ordered. Well, as wanted, I guess. Okay, and we will go in and clean that site, circular motion. Okay, I'll dispose of that. Got my medication ready. This is already pre-dosed out medication for me. So we will get started. Any intramuscular injections are going to go at a 90-degree angle straight into the muscle. Like I said, today we have chose the deltoid muscle. That will go in at 90 degrees, come out at 90 degrees. For some medications, a Z-track technique would be used best to prevent backflow of medication. That would be pulling the tissue back, inserting 90 degrees, closing that tissue back off to hold back that backflow of medication. Today for this flu shot, that is not needed, so I will just be doing 90-degree angle. Okay, so we will pull this off. Like I said, I did my last final check. I have my correct patient and the correct medication. My patient has been identified. So we will start and go 90 degrees in, slowly inject that medication, and 90 degrees out. We'll put gauze over that, not putting too much pressure, but stopping any bleeding that's happening. Dispose of that needle in the sharps container. Okay, and once we are sure that there's no bleeding, no adverse reactions, we will tape over this to prevent So we have their injection site covered. I educated my patient on the flu shot, any adverse reactions that they could have when they would need to call medical assistance, dispose of these in the garbage. They do know that with flu shot, they are at a risk of fatigue, low-grade fever, and some sensitivity in the injection site. They have been educated on what to watch for if there are any allergies or if any of those side effects become adverse reactions that need attention. I will document this accordingly with the time, the number on the medication, and the expiration date for the patient in their records. Thank you.